Hey there. I'm so happy to come and join you all tonight, particularly to talk about one of my favorite topics, which is functional neurologic disorders. And if we haven't met, by the way, my name is Julie Hirschberg. I am a neurologic physical therapist and founder and owner of Reactive Therapy and Wellness here in the Los Angeles area, and get to join you every week to share a little bit about what we're learning and doing here. Today, I really wanted to highlight what not to do for functional neurologic disorders. And honestly, this is very inspired by some of the stories that I have seen. I'm going to share here. Wow, I didn't really think it would look quite like this. So this is a picture of a PDF resource that we made to really help our fellow physical therapists who've maybe never worked with functional neurologic disorders and maybe was like, I don't know, my normal stuff seems to be making this worse, which it will. These were the top 10 things of what not to do. Now, it looks so tiny on here. So if you don't already have this resource, you can go to reactiveeducation.com and download it. It's a really great resource with specific guidelines based on the evidence and the neuroscience of things that you should avoid in functional neurologic disorders if you're a therapist. And I want to highlight let's go top 3. Particularly recently, I've been thinking about this more because I'm encountering people that have been seeing other therapists, maybe an orthopedic therapist, and we're literally getting worse. Tremors getting worse, body shaking getting worse, symptoms getting worse. And that's because a lot of what we do or learn or even what is taught in courses for orthopedic issues are not helpful in functional neurologic disorders. So that's the worksheet. I'll stop sharing it because it's teeny tiny print anyway, but you can go and download it. It's a free PDF available on our website. But let's talk about a few of those top things of what not to do. So one of the first things, and this is a really common thing that you'll see in maybe traditional physical therapy, it's a very body-centered cue. So meaning something like squeeze the glutes or turn off this muscle. That was one that I've heard recently. Turn off the TFL, squeeze the glutes instead, use your hamstrings, feel them, pay attention to them. That is literally the recipe to even contribute to a functional neurologic disorder. So it's exactly not what you want to do. So that internal body focus, honestly, that's not how the brain organizes movement. In the brain, movement is organized around a goal. So here's a good goal. Let me grab my boba and have a sip, right? So my brain does not go, let me open this digit to this degree using this muscle. Let me turn on my left glute to shift my weight to the side to reach out my arm and pick up my boba. No, that's not how it's organized. All of those things do happen with the goal, but we are goal and skill oriented, and that's how the brain organizes movement. That can get hijacked, particularly after an injury or a fracture, a surgery, and you're rehabbing. And this is very common. I mean, I'll tell you, in my very first job at a sports clinic, when I was in PT school, I was all the time, contract this muscle, use this, do this, don't turn on this muscle, turn this on instead. So those body-centric cues bring a lot of attention to the muscle and the body. That can sometimes hijack the normal automatic movement and can become very problematic, and particularly in somebody with a functional neurologic disorder where that attentional piece is misfiring, it can actually make the symptom worse. So bringing that, squeeze the glute could make the tremor worse, for example. So what do you do instead is use an externally focused, goal-directed cue. So instead of saying, depress the scapula, we might say, reach for this target down here. Instead of saying, stepped with your left foot, you're going to put something on the ground, or you're going to give a ball to kick with the right foot. So you're going to constrain it by the environment. An external focus. We also know, by the way, from the motor control literature, that giving an external focus outside of just being in a functional neurologic disorder, but an external focus also really drives motor learning. So even if you weren't trying to make somebody with a functional neurologic disorder worse, providing that external focus can drive motor learning for anybody. So that's number one, avoid the internally focused cue. It does not help. In fact, it hijacks automatic movement. The second, this is another common one that I hear from clients, is that maybe they were told to just breathe. Like, just take a deep breath, just breathe with your diaphragm, just belly breathe. And that person tried it, and maybe they tried mindfulness, and maybe they tried meditation, and it made things worse. So just breathing is not the answer to FND. Now, don't get me wrong. We use breath work a lot as part of autonomic nervous system activities. And if a person has autonomic dysfunction as part of their FND or contributing to it, breath work can be really helpful. But it could also make symptoms worse. And so you might actually need to shift to an external focus with a breath, or look for other ways to access the autonomic nervous system. Joyful movement, play, humming, singing, all other ways that we could access the autonomic nervous system that are away from breath. So telling someone to just breathe, or even just working on just the breath, might not be the best answer in functional neurologic disorders. Now, this third one is another one of my pet peeves, and that is you want to avoid attributing symptoms purely just to a psychological reason. Like, are you just stressed? Do you see a psychologist? You need to see a psychologist. All of those things, while, by the way, I'm such a big fan of psychology, I would go every day of the week if I could, and I do recommend it for a lot of people. It is not the only thing. And while we know there's a history in functional neurologic disorders as being thought of a purely psychological diagnosis, we know better now. fMRI shows us differently now. We know it's a brain connection issue, and it's not just stress. And you know what? If somebody asks me if I was just stressed and I'm having a lot of healthcare issues and symptoms, like, of course I'm stressed. I'm dealing with these symptoms. So functional neurologic disorders are not just stress. You want to avoid that assumption that they are, but at the same time, not ignore it. So don't ignore that the stress of going through all of this, all of these symptoms, of course, it would be stressful, and managing that would be stressful, and that a person should have the support and help that they need for that. You don't want to ignore that, but you want to avoid assuming that that's the cause, or, oh, your symptoms are worse, you must be stressed. Like, oh my gosh, that's a pet peeve of mine. No, stress is not the only cause. Now, can stress worsen things? Absolutely. And usually it's people telling me, a patient telling me, yeah, I recognize that I went through the day and this, and this really ramped up my nervous system. That probably contributed to me having a seizure. And they're communicating that, but making the assumption You want to avoid that at all costs. The functional neurologic disorders are not a just stress disorder. So very important to avoid. So again, I'll remind you, it looks like this. Let me share it again here. This is the resource that our very amazing orthopedic physical therapist created this. The 10 things ortho PTs should avoid when working with someone with functional neurologic disorders. And honestly, I actually think a person could help someone prevent a functional neurologic disorder from occurring by following some of these things when they're working with somebody in acute pain as well. Because I think some of these things would actually help promote those automatic movement patterns and decrease some of those attentional changes that can occur after an injury. So I highly recommend it. I'm trying to stop sharing this here. Highly recommend this resource, 10 Things to Avoid with People with Functional Neurologic Disorder, totally free. Brittany put it in a super easy to use one-page download. You can get it at reactiveeducation.com. And we're going to keep talking about this because literally every week, every active, we're meeting folks that working in a traditional way, with a physical therapist really worsened their symptoms. And honestly, that's not okay. So we're just going to keep educating everybody about how you can help people, because there's a lot that physical therapists, occupational therapists can do to help people with functional neurologic disorders. So go download it. It's at reactiveeducation.com. And please share this. Please share this with other healthcare providers. We think it would really help the world of people with functional neurologic disorders. So thanks so much for joining me tonight, and I will see you soon. Have a great evening. Bye.